The time now 7:14. The U.S. sees far fewer flu cases than normal this year. Touro family medicine physician Dr. Meredith Maxwell joins us to talk about what exactly is up with that. Good morning, Dr. Maxwell.
Good morning.
So we have beaten the flu into submission, essentially?
Well, let's just say it's a lot less than it usually is. Typically, we peak between December and February. There's about 45 million cases, 61,000 deaths. But COVID and the wearing of masks and the hand washing has really pushed it down this year. However, we don't track the flu like we do COVID, so it's not as accurate. It's always an estimate.
Well, I think that's an interesting point because I think in terms of understanding the numbers, since we're talking about them so regularly, we're not going to catch every case of COVID, but we're trying to catch every case, and you're not really doing that with the flu?
Exactly. There's only a few different surveillance systems in around the United States, like 100 public health people, some doctors' offices. So it's usually just an estimate. So it's not as accurate right now because we are trying to track every single COVID case.
But the point is, it seems that wearing of the mask has dampened down the flu because perhaps the flu is not as contagious as COVID, for example, so masking is working against the flu?
And that's a really important point. So there's something called a reproductive number. So when one person gets the flu, about 1.28 other people get the flu, because it's not as contagious. But when one person gets the coronavirus, about 2 to 2.5 people get the coronavirus because it hangs out in the air a lot longer than the flu. So it's easily transmittable.
Address this for me, if you would, as a health professional, because I'm sure you've heard, I've heard commentators, not doctors, on generally on television say, oh, or you'll see it on Facebook, oh no, they're counting everything as COVID and suddenly the flu just disappeared. You've heard that criticism. What, as a health professional, what do you make of that?
I think it's just not as in light in the public eye right now. And, because coronavirus is new and because it's on the forefront, I think it's getting a lot more attention. And I think that our hand washing and mask wearing has definitely dampened the numbers, but those could be falsely lowered because we just don't track it as accurately. The higher reproductive number means it's more challenging to prevent the transmission of the coronavirus.
Is there any kind of a lasting effect here? Have we beaten down the flu in some way, or is there an immunity issue where it comes back next year with a sort of a vengeance? What do we look forward to?
And that's a great point. So a lot less people are going to have the flu this year. A lot less people are going to confer immunity to the flu this year. And I'm seeing a lot less people actually get the flu shot this year. So it may come back with a vengeance next year where we may not be wearing masks. We may not be washing those hands as much. And it might be a lot worse next year. So I strongly recommend that everybody still get their flu vaccine because of that reason and to protect others around you. I think that's really important. And another thing, if you're getting the COVID vaccine, be aware that you cannot have any other vaccines within 14 days. So if you're scheduled, be really wary about that timing.
Especially with different healthcare providers doing those things. Okay. All right. Thank you very much, Dr. Meredith Maxwell. We appreciate it.
Of course.